health, or more particularly, health insurance. Using one of my favorite words from my years in New York, forget about it. And especially to my American friends, this may come as a bit of a shock. But my decided and definitive answer as your comprador is no. Do not do it. Do not even contemplate it. In other words, forget about it. So there's 3 reasons why you should forget about it, and 2 exceptions that may prove that rule. The first is that we have an excellent public and private healthcare system here, but primarily the public healthcare system, which is paid for out of taxes by the Australian government. Nobody here expects to have to pay for health. Everybody here knows that whilst there may be out-of-pocket costs, there is no such thing as medical costs bankruptcy. It just doesn't happen. And though there is an active private healthcare sector, and it caters to a certain demographic, Aussies do not expect that cost to be built into their package. It isn't so. And so if you're going to do it, you're putting yourself as an employer, with your adding to your cost base, you're going to be making it more easy for you to be more costly than your competitors. Because I can tell you, your competitors in Australia will not be offering health insurance as a standard offering to their Aussie employees. And finally, and here's the kicker, the sting in the tail, my favorite topic, fringe benefit tax. If you do offer health to your employees, and to a similar degree, life insurance and other insurances, you, as the employer, will be stuck with the FBT bill. And the FBT bill is egregious. So if you pay, for example, across your small employee base, say $10,000 of insurance costs, you will have to also then pay the government $907 for the privilege of giving those benefits to your employees. As well as the $907, you have the administrative costs of running an entirely different FBT scheme of financial reporting that is outside of the normal tax regime. You also have to cope with the expectation that your employees can choose their own health insurers. So that is ingrained in laws similar to super, that they have right of private choice. And therefore, you may have 10 employees and have to deal with the administration of 10 different insurance providers. So there are 2 exceptions. The first exception is if you bring in people on visas, 482s, 82s, whatever it is, then they are required, if they're coming in from your head office or other regions, they're required to have health insurance as part of that visa. And you, as the employer, are required to ensure that it is engaged. So, therefore, for those individuals, you just suck up the FBT. And then there's a second group of people, what I would call Aussie lifer, foreign traveling expats. Now back in Oz, they've possibly spent years getting to the top of the organizational pyramid, and they are expecting, because of their years in other countries, health, life, whatever other benefits, whatever other perks. And for them, if you want to remain talent acquisition competitive, you also have to just pay it. You have to accept the additional FBT cost as an ongoing cost to business. This is CJ Warrick, your comprador in Sydney.